Hi, everyone. This is Emma with March on the Pentagon. And I'm here with Cindy and with Margaret Flowers, and we're going to do a special live stream for you guys. But first, I wanted to remind you all that we are selling a t-shirt right now. We only have a couple more days left of our last t-shirt fundraiser for Rage Against the War Machine. So if you head over to our website, is the easiest place to get there. It's marchonpentagon.com. And if you scroll down, you'll see a big graphic that has a picture of our shirt on it. And if you click on that, that will take you to where you can get the shirt over to Custom Ink. And you can order the shirt right there. And you can also add a donation if you'd like to. There are, I think, 2 or 3 more days left. So you have until September 3rd to order your short sleeve shirt, child's shirt, long sleeve shirt, or a sweatshirt. This is the first time that we're offering a sweatshirt, which is exciting because we were really cold last October in Washington, D.C. And maybe it'll be cold this time. We don't know. But most of us had t-shirts last time and they were covered up by jackets and sweatshirts. So if you want to be prepared, you can order a sweatshirt, but you only have 3 more days to do that. Also, if you want to support us in other ways besides ordering a shirt, if you've already bought a shirt, you can head over to our website and click on Support Us is a drop-down menu. You can click on Donate, and there's a way that you can donate to us there, or you can go to the next option is our store. We have some stickers and buttons for sale and bumper stickers and stuff like that in our shop. And that's another great way that you can get something while you're supporting March on the Pentagon and helping us raise some funds that we need for Rage Against the War Machine that will be here soon. Actually, also over on our website, if you hadn't noticed, we have a countdown towards the bottom of the page. We have 39 days left, which is not too much time. So now I am going to hand it over to Cindy. Let me bring her up on the screen. Hi, Cindy.
Hi there, everybody. Hi, Emma. Thank
Hello.
you.
And we also have Margaret Flowers with us, and we are going to talk about the issue of healthcare, not warfare. Healthcare is one of many things that we could be paying for and could be providing for people in the United States if we were not spending most of our money on the war machine. And then there's also, I don't know exactly what you guys are going to talk about today, but there's also the issue of the health crisis that we're causing all over the world too. So we're not just affecting our own healthcare here, but we're causing problems for people everywhere else. So I am going to head off the screen in a moment, and then I will share our Custom Ink website with you guys in the comments, and I'm going to keep an eye on the comments. So if anybody has a question during this, you can type it in and I'll keep my eyes on that, and then we can ask questions towards the end. So I'll hand it off to you now, Cindy.
Thank you, Emma. Hi, everybody. So I just want to make a small correction. Emma might not know this, but apparently she doesn't know this, but the fundraiser has been extended until the 5th, September 5th, the t-shirt fundraiser. And we also have, like Emma said, 39 days left to plan for Rage Against the War Machine. And we do have a planning meeting this Thursday at 3 o'clock Pacific time. So if anybody wants to join, we'll post that information on Facebook. So this is a really important time to Rage Against the War Machine for sure. And it's not like Obama stopped it and he in fact expanded it. It's not like Trump is stopping it. But people who protest that seem to be having other priorities. And we just really feel like being anti-imperialist is one of the greatest priorities of our time. And why do we feel that? Well, because we've been trying to have an education series about what could the U.S. actually be doing if it wasn't spending literally trillions of dollars every year on empire and maintaining empire. And one of the things that is so egregiously, is that a word? Egregiously lacking here in the United States is a sensible, sane, accessible healthcare policy. And our guest today, Margaret Flowers, has been on the front lines of demanding an inclusive, accessible, some kind of a national healthcare plan. I've been to, and I'm sure Margaret has too, been to many countries that are much poorer than the United States that actually provide this kind of holistic, free to citizens healthcare for its citizens, Cuba being one of those places. But before we get into healthcare for all, Margaret, I just want to welcome you. Thank you so
Thank
much
you.
for being here. And to ask you if you've ever seen the video that Joe Biden's campaign produced on healthcare.
I didn't watch it, but I certainly heard about it. And
it was absolutely disgusting. Yeah. It was like, I don't even know what the point is, because I know poor old Joe Biden wasn't on eCam or YouTube making his own video. I'm sure he had advisors and filmmakers making this video, but it's almost like, I sat at the bedside of my wife and my daughter as they died from this car accident. My son died, and if we didn't have good healthcare, I don't know what would have happened. But for one, his family died, so I don't understand that point of it. But for another, it's like, of course, he's got this premium, what do they call that? Healthcare, where Congress's healthcare pays for 110% of their care. So of course his family had good healthcare. But what he's trying to say is, Obamacare and the system we have now should not be modified to a national health care plan, because that would be harmful for him. I just don't get. You need to watch that video. It's puzzling.
Right, and also I understand that even though the Affordable Care Act was in existence, his son still ran up such huge amounts of medical debt that President Obama offered to help pay for that. So, and that's the reality that families are facing. I mean, a lot of families won't even access the healthcare system because the upfront, the cost is a barrier. But if they do have to interact with it, there's always that worry about whether they can afford it. And it's also spilling over into impacting physicians who know that the decisions they're making for their patients can also cause financial trauma to them as well.
And you are a physician, and I first started to hear about you in 2009 when the ACA was being debated, and Obama didn't even allow people who were advocating for single payer or Medicare for all to be part of the discourse. And so you were standing up during the debates or hearings or whatever, demanding that.
Yeah, that's right. I was and still am with Physicians for National Health Program, and we knew that healthcare was going to be a big issue, and so we were organizing to be in Congress and push on that debate. Starting in December of 2008, we were meeting with members of Congress, and Obama held this healthcare at the White House thing in March, and he didn't invite anybody that supported single payer. So we protested that, and just throughout the year, we were trying to push to have it be included as part of the debate. What would actually be better for our country? But I just saw so close and personally, how corrupt that whole, process is in Congress, and the stakeholders were really the people that make money off the system, not the people that need health care.
Well, and the one thing about the Obamacare or the Affordable Care Act, which is so Orwellian,
yes,
is that, people see Joe Biden is so out of touch with reality. It's just really pitiful. Most people I know, if they don't get it from their work, which if they were getting health care from their work, their premiums went way up when the ACA was instituted. I heard from a lot of managers that they had to lay off or cut back hours because they couldn't afford it either, which was really weird. But people are paying so much for premiums, they can't go to the doctor. They can't, because they can't pay for their deductible or copay.
Right. I mean, probably one good part about the ACA, and this is only good in the context of, well, if this is what we have, was that it expanded Medicaid to a lot of people. And so a lot of people now are getting health insurance through the government and access to care, even though there's a big variability between states in the quality and what they can have. And now states are trying to put barriers in there too through making people pay for it up front. But, a lot of people who were forced to purchase health insurance, they have this health insurance, and in a lot of cases, they can't use it because the insurance companies, one thing they did was they restricted their networks. They made them extremely narrow, so it's hard for you to find a doctor that your insurance covers. They cut out major medical centers where people go when they have serious health problems. So if you have to pay out of pocket, if you go out of network. And then just these really high deductibles and co-pays that people have to pay before their insurance even works. So I hear from people all the time about, those difficulties and how every January their premiums go up by, double digits. And yeah, people are really, it's such a scam when you think about it. And I actually wrote about it that way in 2013, that you force people to buy something that doesn't even actually work for what they need.
Because you get a fine, right? You're fined through your taxes if you don't.
Theoretically, the reality is that the legislation didn't have an enforcement mechanism in it. So if you refuse to pay the fine, which actually I did, I don't have health insurance. But now the mandate is gone, so you don't have to worry about that. But I was
never worried about paying the fine because I'm also a war tax resistor, so I don't pay my taxes. So the fine didn't worry me, but it just seemed to me so the literal definition of fascism to force citizens of the country to pay for a private product.
Right. Yeah. What's next? What are we going to force people to buy next? And it was interesting because at that time, right after the Affordable Care Act, Obama started pushing this MIRA thing instead of Social Security, that people would purchase into like a Wall Street, pension plan, and they called it like MyRA. And fortunately, that didn't go anywhere. But we're just seeing a real degradation of our public programs in the United States, and have been for a while.
My healthcare plan is probably the same as many, is try to stay healthy till I'm 65. I can get Medicare if it's still there. And, if I don't have to pay so much money for Medicare, A, B, C, D, whatever they have. And so the reason we're having these educational talks with people who, are, obviously on the same side we are with this issue, is, as a matter of fact, I think the Congress just passed something like it was over $1 trillion war budget. Was it almost like $1.78 trillion or something like that? Mm-hmm. And, people are saying, first of all, this is the thing. A lot of people say we have the best healthcare system in the world, which, on any ranking, we're way down. Of all industrial nations, the United States is the worst. But they always say, well, we can't afford it. And so talk about how much it would actually cost to have a sane, accessible, holistic healthcare program for America, and how much out of the Pentagon war machine budget would we have to cut, or would they have to cut?
Yeah, I mean, the Pentagon budget is obscene, and of course it's bipartisan. Every year Congress gives them more and more money, and it just, if you look at how that's eating up more and more of our discretional funding, it's up to almost 2/3 of our federal discretionary funds are going to the Pentagon, which is outrageous. But the reality is that in the United States, we could provide high quality, comprehensive health benefits to every single person living here for the amount of money that we're paying right now, and we would start to save money over time because we get rid of all this waste that we have in the system right now, all the profit that we have in the system. 1/3 of our healthcare dollar is just used on paperwork, and that's paperwork by the people who design all these different insurance plans, and then people that have to sell them, and you have to have consultants to tell you about the different plans. And then once you get a plan, you have to have people that say, well, where can you go? And if you go here, how much do you pay? How much do they pay? It's just really bloated. And then physicians and, health professionals also have to deal with a tremendous amount of paperwork that takes away from time with the patients. And So we could wipe that out and create some sort of a single payer system like a Medicare for all or a national health service and save hundreds of billions of dollars every year just on reduced paperwork. And that money can then go to actually pay for health care. And then the other big part is the high prices that we pay, because unlike other countries, we treat healthcare as a commodity. So the pharmaceutical companies are charging whatever they can get away with, not anything related to what it costs to produce what they're making. And there's this whole fight between health professionals and insurance companies and businesses over the prices and this consolidation of power. So we see our healthcare system becoming very consolidated so that they have the power to be able to charge high prices. So it just is a huge demonstration about why healthcare is not a commodity and what happens when you treat it that way.
But everything's treated as a commodity here in the United States.
Yeah.
I always get distracted by comments, even though I'm not supposed to be reading them. So one thing, I think, was it HRES? I forget the number, but it was the one that John Conyers.
676.
676. I thought so. I think it even provided for money for the first few years to retrain people who do billing and things like that, because it wouldn't be needed.
Right. So HR 676, which was our bill in Congress, and John Conyers introduced it every session for us since 2003, was really what we look at as the gold standard for the system. If you're looking at a national improved Medicare for all system, which is one type of single payer system. And it was based on something called the Physicians Working Group proposal that was written by physicians back in, Physicians for National Health Program in 2003. And these are, PNHP is very different from the AMA. The AMA is about protecting doctors' interests. PNHP is really about doctors who are public health advocates and experts in public, health policy about what would be the best policy for our country. And so it would be a single system that covers every single person from day one, that you only pay up, in through taxes based on your ability to pay. And then you don't have any finances beyond that. You don't have to worry about a copay or a deductible when you get care. It would be very comprehensive, covering like all medically necessary care, including things like long-term care. So, that's a huge issue for people who need long-term care. Substance abuse, reproductive health, mental health, dental, vision, hearing, all of this would be covered, and it would just be one big system that everybody is in. So wherever you go in the United States, you're in the system, you can go to whatever facility. And then it did have a just transition for workers, so that if people were displaced from their job, they had priority to be the first ones hired back in. You still need people to work in the system and to administer it. But if they weren't hired back in, they would get job retraining and salary support for 2 years while they go through that adjustment. And so it was really something that when we lost Conyers from the Congress, we lost that legislation, and none of the bills that are in Congress right now are as good as the Conyers bill. Another piece that was really good about it is that it bought out all of the for-profit facilities, because they're just a ripoff. They charge more and they have lower quality. And it would, the thinking right now is in Congress is that, we'll just tell them they can't make a profit. And our thought is, and so do you think that they're actually going to continue doing what they're doing if they can't make a profit? No, they're going to sell their property, or they're going to become something else. Just like we're seeing in Hahnemann in Philadelphia right now, is a hospital associated with university that serves a very, low income population, and it's going bankrupt, and they're turning it into condominiums. So we think that we should buy out these facilities, just get the whole question of profit out of there and use them, make sure that we have them to provide services, because we also need to be building new facilities. We've lost a lot of hospitals because of this system. If a hospital is not profitable, they just shut it down. So particularly in low income or rural areas, people are having to travel 50 to 100 miles to get healthcare, and it's causing deaths en route because, people can't get there fast enough.
Where have you studied healthcare systems that actually work?
I mean, we've looked at a lot of different ones, and France is one of the top ones. Australia, Japan. The UK system, the British system is a national health service. Looking at places like Cuba, we had a delegation of health professionals from Cuba come up and give a series of talks about the system. I know you've seen that. And then I was in Venezuela and went into the barrios where you see, these full service hospitals and dental clinics built there in the communities where people need them. And then if you look at kind of the more expensive systems like Switzerland or Germany, people keep saying that we should do one of those systems here in the United States. They keep a private insurance, but the private insurance in Germany came out of their guild system in the late 1800s. It's always been about paying for care and not about making money. And the Swiss system is very heavily regulated, and they have a higher standard of living there than we have here in the United States. So we can't really compare those to what health insurance here is here in the United States. Here, health insurance is it's classified as a financial instrument, and that means that it has to make a profit for its investors. And so it has to do that by charging premiums as high as it can, shifting as much of the cost onto people as it can, and then denying payment for services whenever it can. And that's totally opposite of what we should be doing.
Yeah, a lot of those countries too, they don't spend nearly as much as the United States does on the military-industrial complex. As a matter of fact, as everybody knows on this call, the U.S. spends more than the next 10 countries combined on the military-industrial complex. So, I think a lot of issues are important. I think that, healthcare in the United States, like Emma said, around the world is really important. But education is really important. We see doctors, and you're a doctor, so who come out of medical school with, hundreds of thousands of dollars of debt, student debt, right? And so, this is like all linked together. We saw in Michael Moore's movie, and I agree with everything he says, but when I watched his movie, what was it called, Sicko?
Mm-hmm.
Showed a doctor in Great Britain. The doctor's like, I don't live in the lap of luxury, but I'm comfortable. And that's kind of the thing, is that how can everybody just be comfortable? And then you see, like in Cuba and Venezuela, where dental care is also included, but in the United States, I see so many of my friends and families suffering from tooth problems and toothaches, abscesses, whatever, because as much as we have a terrible medical insurance system, the dental insurance is actually worse, but it shouldn't be separate. Is our mouth like separate from the rest of our body? Our teeth are just bones, and I've got bones all over our body. It should be, like you said, all included.
Right. I call it body part medicine. It's like, well, we'll cover this part of you, but not that part of you. It doesn't make any sense. And you're probably aware, living in California, that thousands of people cross the border into Mexico every day from the United States. There are these towns set up along the border that provide dental and vision care at a much lower cost than what people can get in the U.S. And so it's a whole, market that's grown up there. But I wanted to touch on something you said about, countries that spend less on the military and provide universal healthcare systems. It's a whole different mindset of how you view what the government's role is or responsibility is to the society. That, if you look at countries like Cuba, Venezuela, other countries, even European countries too, they understand you need to provide high quality education. Higher education needs to be free. People need to have health care. There's basic things, pensions, decent wages. These are all things that people need. And we have the opposite here in the United States. We're seeing things going, our schools are getting privatized. Education is, outrageously expensive. And the whole thing with medical education being so expensive is that it's starting to skew who goes to medical school. I grew up I was the youngest of 5, a single mother, and the only 2 out of the 5 of us graduated from high school and, went to college. No medical background in my family, but I was able to actually work and pay for most of my school, and you could get, loans that weren't outrageous then, and go to a medical school, a public medical school. So that's very difficult for people this age, in this era. They don't really have those options.
So what's to be done? What should we be doing to, first of all, when people who aren't really left or even really progressive talk about Medicare for all and stuff like that, they never address, like, how's it going to be paid for? Sanders always says we're going to raise people's taxes or raise taxes on the rich, where that's not even necessary. Just reassess priorities. And so it makes everybody go, socialism, it's terrible. So how do we address it? How do we frame this issue so people would go, yeah, that sounds good. I wish we had that here in the United States.
Well, I think in a lot of ways that's actually happening, which is amazing, because the media has never really been a friend of people that are trying to advocate for a Medicare for all type of system. But even despite that, people are getting it. I remember last summer, doing petitioning out in conservative communities, and people were like, "Oh, you mean like Canada has? Oh yeah, like Canada. We want what Canada has." That's their kind of vision of what it is. So what we're seeing now is that there is public support for it. Members of Congress and candidates are feeling like they have to talk about it, or, some of them are saying they're for it. Others are saying, oh, I'm for it, but I would do something else first. That's too radical. And other people are just against it. But at least the conversation is happening. So I think what our role is to keep pushing on the people in power, because, we can't expect even people like Sanders, who says, he's such a big proponent of it. There are serious flaws with what he's putting forward. And so we have to be really clear about what we want and not get swayed when they say, well, you're asking for too much, or, this is really basic. This is something that other countries do. We have these systems for, certain parts of our population in the United States. So it's not like we don't know how to do this type of a healthcare system. It's really, how do we defeat the moneyed interests that are making so much money from it right now? So I think just being really clear about what we want. Everybody should be in it. Everything should be covered. We should not have to pay out of pocket. Congress ideally should just appropriate the money. We're already spending 2/3 of our healthcare dollars are public anyway. So, I remember being in an armed services hearing once in Congress when a general said, well, we need $500 million more dollars for this. And the committee just said, okay. And at that point, I stood up and I was like, well, what about healthcare and education? Can we get some money too? And got escorted out for that one. But, it was just so maddening. They never ask that question when it's something, a huge tax cut for the rich. Well, how are we going to pay for that? That was never a question. So,
and I'm not against raising taxes on the rich, by the way.
Oh, no.
I'm not for it. And maybe some people like Bezos should have their income tax at like 99%. I think then we wouldn't have to worry about this. But I just think that in ways of framing this issue, we have green candidates, we have socialist candidates who do say, if we just cut the military-industrial complex, we could pay for education, free healthcare. And it's not really free. I mean, we're members of this society. We do, and I would be in favor of paying taxes if they went for, wonderful things like that.
Right.
So.
Well, what else is the government for? I mean, they're supposed to make sure that we have affordable housing and good quality education and healthcare. That's what they're actually supposed to be for, but our government is not at all.
The United States government is for killing people that aren't our enemies. I think that's about
or starving them.
And making a very tiny percentage of people rich and really forcing harsh austerity on the rest of us. So Margaret, thank you so much. Emma, do you have anything to add, or Emma, are there any questions from the people who are listening? We could talk about your trial and things like that if you want to talk about that. But does anybody have any questions on healthcare?
So far, I'm not seeing any questions. So
We have a very quiet audience all the time.
Well, if people want to, find out more, they can. We do have a Physicians for National Health program is a really excellent resource, pnhp.org. But we also have a campaign through Popular Resistance called HOPE, Health Over Profit for Everyone. And you can go to healthoverprofit.org and learn more about what we're talking about. And just people should understand that when we're saying Medicare for all, we don't mean just expanding Medicare to everybody. We're talking about actually creating a system like Medicare where you pay through taxes or whatever, it's publicly financed, and then people can get the care they need. But it is really about creating a system where we can plan, build hospitals where we need those hospitals, make sure people can get what they need in the United States.
We'll talk about, some people think that the VA system should be expanded to, what do you think about that?
The VA, the only reason it's struggling, well, two reasons. One is that we're not funding it adequately, and the other is that we're creating so many patients for the VA. But as a system, it's actually the most efficient. And the doctors I talk to who work in the VA system love it because all they have to do is focus on their patients. They don't have to worry about whether they can pay for what they need. When it comes to like medications, they don't have pharmaceutical representatives coming and bothering them. The VA has its own department that looks at the medicines scientifically, what works, what makes sense, what should we buy, and then provides that information to doctors, which is, as a physician, when I was practicing, you're busy practicing, but then you have all these different pharmaceutical representatives coming in with their skewed studies and trying to convince you that you should use their thing, and there's no real body to go to say, well, what's actually best, what works. So that, we would have something like that. So I would definitely support any kind of single payer system, a VA type of system, or a Medicare for all. The reality is, I think right now that with the consolidation that we're seeing in our healthcare industries and the power that they have, that a VA system probably makes the most sense to just nationalize it, because I don't know how we're going to regulate these different entities, even in a Medicare for all system. It's going to be a challenge.
One thing I hear from conservative people is, oh my God, Canada, they have to wait forever to get an operation, or they have to wait in the waiting room forever, and blah, blah, blah. Well,
they don't get turned away. They can get it.
Right. Yeah. And, I would think the more serious the condition is, the less time you would have to wait.
Oh, yeah, absolutely.
Conditions are like not, you don't need to have the surgery tomorrow, but it's preferable to not having an alternative, Right. I don't even there's no way I can even go see a doctor.
Yeah.
So what if people have to wait? And like I said, well, we can go to emergency room if something really bad happens. At least they have an option. They have somewhere that they can go.
Yeah, in other countries, first off, those waits are really exaggerated, and there's a whole kind of industry behind finding horror stories and then blowing those up as if that's what everybody experiences. But, in those countries, when you need emergent or urgent care, you get it. Here in the United States, you may not even be able to get into a line. And even with health insurance, sometimes the out-of-pocket costs are so much that people don't get the surgery that they need. And that doesn't happen in these other countries. And people don't go bankrupt in these other countries when they get sick, as happens to over 500,000 families a year in the United States.
Well, another thing is, I don't remember the percentage, but like this huge percentage of GoFundMe pages are for healthcare costs.
Yeah. I did an article on that a couple of years ago, but yeah, it's a huge, it's millions of GoFundMes for medical costs. We had that experience with the Venezuelan embassy. One of the people that was part of the Venezuelan Embassy Protection Collective was assaulted twice outside of the embassy and injured and couldn't work. And we had to set up, a fundraiser to cover his medical costs and, basic living costs while he couldn't work.
That's disgusting.
Yeah.
That's disgusting country. So, talk about that. You were arrested, and what's the status of that right now?
Well, folks should know that we were in the Venezuelan embassy for 37 days in April and May because the United States is handing over Venezuela's assets to this, U.S.-backed coup leader, Juan Guaido, and they were going to turn over the whole embassy in Washington, D.C. And that's a violation of the Vienna Convention, which requires even when there are no diplomatic relations or countries are at war, they still respect the embassies. So we asked if we could stay in there and try to prevent them from taking it over. And the Venezuelan ministry, foreign ministry allowed us to do that cautiously at first, but then they, trusted us more as they got to know us. And the U.S., they couldn't evict us because we were there legally. And they sent in all of these people to surround us and harass us and keep us from getting food and shut off our power and electricity. And we still wouldn't leave. And so finally, I think as things were shifting and we were starting to get more attention and more people coming down in support, they broke in violation of the Vienna Convention and arrested 4 of us. We were down to 4 people just because we were trying to make what water and food we had last as long as it could. We were hoping that the United States and Venezuela would reach what's called a protecting power agreement for their embassies, where they find another country to watch over it for them, but they didn't wait for that. And so we are facing federal charges of up to a year in jail, up to $100,000 fine each. And the government has also made it clear that they would like to charge us for police time and things like that as well, if they can get away with it. So right now we're just in that very lengthy part of lots of what's called status hearings, the boring part, and probably won't go to trial until early next year. But we do have a defense committee that's supporting us, and they've launched a campaign calling on the government to drop the charges since we were there legally. And so that's kind of, where that is right now. We're just really trying to get the word out about what's still happening in Venezuela. The United States is not giving up by any stretch. President Trump on August 5th started a real blockade of Venezuela, blocking ships from getting there to bring food and supplies and things like that. There's been an oil blockade. Now the U.S. has just opened this new office in Bogota, Colombia, the Venezuelan Affairs Unit, to help with the coup, support the coup attempts. And just this week, Venezuela discovered these training camps along the border in Colombia, and they're building bombs to try to blow up police stations and the judiciary. So the U.S. is just literally trying any way they can, and we need to be saying, no U.S. intervention, stop the blockade, it's illegal. It's killing Venezuelans. It's warfare, but we don't see the guns and things, but it's really just as much warfare as attacking the country.
Well, they've said like tens of thousands of people because of sanctions, because of attacking the electrical grid, and people needed electricity for medical support supplies and things like that. But look at in the sanctions during the Clinton administration against Iraq killed like
500,000. Yeah, well, the children, it's like 500,000 children under 5, and Madeleine Albright's like, well, that was worth it.
That was worth it. Yeah. So sanctions are is an act of warfare, and the stated purpose is to get the population to turn against the leadership, but that never happens.
And it's not going to happen. I mean, you've been to Venezuela. You know how the people are.
Yeah, it won't happen in Venezuela.
I understand what's going on.
Yeah, it's really sad. So they're suffering so hard for the crimes of the United States government. We did have a question from Sharon for you. Okay. So one of the biggest challenges is convincing more Americans that the U.S. government is not acting in the interest of the public and getting people engaged in changing that. What are your suggestions?
That's a great question. I think, just engaging in conversations about, it kind of depends on who your audience is, but just looking at the reality of, what are the conditions of daily life for people? How many people are economically insecure? How many families are struggling to afford their health care. And you can look at our neighbors, look at Canada, look at Mexico. Mexico started a universal health care system, I guess about a decade maybe ago. So we're flanked on either side, by countries that do this, and they're still fine. Actually they're better. They have better health outcomes than we do. So I don't know. It's just really, I think I always look at when you're trying to change somebody's point of view, it's not a one-off kind of thing. It's a conversation, and you have to listen as much as you talk about it and hear where they're coming from, and then try to find some connection based on what they're saying that you can start to bridge that.
We have a comment from Hannah. She says, as a person with a primary immunode
Deficiency.
I thought it was like immune node, but it's immunodeficiency disorder, who has to navigate these systems for life to get life-saving plasma donor immunity. I sure hope your vision becomes our reality in her lifetime. And then she also asked, where can people go to sign a petition to get the charges dropped against you?
Oh, thank you. Yeah, I agree too, Hannah. For everybody, there's so many people that have such health needs. This is really an urgent, critical issue. As far as the embassy protectors, there's a website, defendembassyprotectors.org, and it's on the right-hand side, I think, if you go down. Or I know there's a press statement on the front page. I'm not in charge of that website, but you'll see it on the homepage.
I do have, I guess Emma lost her connection, so she messaged me, so I have to read the comments now. So here's one from Penelope. She says, Dr. Flowers, thank you for pointing out the obvious to us that that the government is responsible for people's healthcare, housing, and education.
Yeah. And that's actually one of the reasons why I think it's so important that we advocate and push for a healthcare system right now, is that it starts to change that whole mindset. Once people understand that we can win a healthcare system for everybody, then we can fight for, we'll be empowered to fight for education and decent wages and pensions and, all these things that we need.
I was at Cuba last year, and we went to a university, and it was the place was packed with students who were learning English. They were in the English language program, which is very rigorous. They have a very rigorous education system there. And so I was telling the students about how our young people go into tens of thousands, if not hundreds of thousands of dollars of debt, that they have to maybe even have jobs to pay for housing and books and food. And they were looking at me like I was telling them some kind of a lie. I'm like, and I'm not even exaggerating. They can go into several different programs after high school. They can go into a university program, and it's all due to testing. And if they get accepted to university, everything is paid for. Books, housing, food, whatever. They don't have to worry about any money at all. Or they can go to like an apprenticeship program, which is wonderful, because not all of our children are
interested. Yeah, some people would rather be doing more hands-on. Yeah.
So I told them, my son joined the military and got killed because he was promised a college education. And my daughter went into much debt to get her college education, and she probably never will pay that debt off in her lifetime. And then my other son lucked into an apprenticeship program, but they just can't believe. And so then we look at some of the young people in Cuba are looking at U.S. TV thinking, oh, I really want that. So the people in the United States need to know the truth about Cuba, but the people in Cuba, the young people, need to know the truth about the United States too.
Yeah.
And especially our young people are struggling really hard.
And they can't buy houses. They don't start families. It's like we're shooting ourselves in the foot. Like we have this very uneven economy where you have some extremely wealthy people that are just buying extravagant things, and then a lot of people who can't buy the things that they need in their basic, lives.
I saw Emma put up a comment. Emma, are you able to do video or are you just on comments? Did I just hear Kevin?
Oh, yes, you did.
Hi, Kevin, please. So,
we're in a very tiny cottage. There's nowhere really to go.
That's where I live, in a very tiny cottage. So, Margaret, is there anything else you'd like to add? If anybody else has anything, they can type in comments. But
I mean, yeah, go to the Health Over Profit if you're interested, the healthoverprofit.org website, and you can always get in touch with me if you have questions about these things. We have regular national calls that are educational calls that you can listen to, the ones that were happened in the past or join the future ones. But I think that, I love what you're doing about connecting all of these issues, because this is really critical. I think in this time, to build real popular power, to change what's going on, we need to understand the connections between all of these issues and be working in solidarity, not only inside the United States, but I think international solidarity is really critical as well. So thanks for all that you do, Cindy and Emma.
Thank you, Margaret. So this has been March on the Pentagon, our education program. So people can also go to marchonpentagon.com. Emma put a bunch of links. And, join us in these important conversations. And really, we need to start shooting up, in so many words. I don't mean really to do that, but, to really demonize greed, demonize war. All these things have been made so normal. And so they've become so normal is that people who talk about national health care plan, people who talk about peace, people who talk about free education, these are just like we're talking science fiction. They haven't been even done in the United States before. I don't know about healthcare, but when I got out of high school, university was very, very cheap.
Right.
So it was not like these things haven't been done before, and they're not being done very successfully in other places. So Margaret Flowers, thank you so much for what you do, and hope to collaborate with you more in the future for sure.
Definitely. Thank you.
Okay. All righty. I don't know how to end this, so I'm just going to, I think I'll just get out of Chrome maybe. I don't know. Emma, do you? Oh, wait. So we have this, because I think Emma, I'm not a host, so I have no dang idea. Maybe I'll just press the X. Okay, bye. Love to go.
Bye. Thanks
so much. Bye-bye.
Bye-bye.